Hi everybody, welcome to Ask the Medical Experts. I'm Danita Cohen, the Chief Experience Officer at UMC, and I am joined today by our Medical Director of Infectious Disease. But first, let's talk about flattening the curve. How are we doing statewide and here locally?
I think we've succeeded in what we intended to do when we implemented all these mitigation measures. All of the hospitals throughout the valley and throughout the state still have a very high number of patients that are sick with COVID-19, both in our medical floors, and many of them are in our ICUs. Many of these patients are still on the ventilators. So while we are optimistic, we are very cautiously optimistic with these intense mitigation measures, with the cooperation of the public. We have succeeded in reaching a peak. We've succeeded in getting to a plateau, but this is not the time to lax all those social distancing measures and all the hard work that has been put in. You know, a few days of relaxing all of those measures can completely reverse all those efforts and sacrifices that we've made.
I think it's hard for people who are not in healthcare to understand how sick patients are when they get COVID-19. What are you seeing when you walk through our ICUs, and what are other hospitals seeing?
So, you know, when this pandemic started, everybody was talking about that very old person with multiple medical problems who got COVID-19 and then got extremely sick and ended up on the ventilator. The general impression was that the vast majority of people who would have the infection would actually have a very mild illness. While for the most part that is still true. The reality of it is what we're seeing in the hospital is pretty much people belonging to absolutely every age group. We see people in their mid-20s, in their 30s with absolutely no underlying medical problem who present to the ER with a relatively mild illness. They tell us that one day they just had a fever, and before you know it, 24, 48 hours later, the shortness of breath worsens, and the next thing you know, they are being intubated and they're on a ventilator. So this is a very serious illness. It can start in a very mild, very insidious manner, and before you know it, these patients develop severe respiratory distress and are on a ventilator. And the very challenging and very difficult thing is this is unpredictable. You know, initially there was this false sense of reassurance that you could predict that it would take a turn for the worse in elderly people, in people who had underlying cardiac and lung disease, or perhaps who had other comorbidities like cancers or immunocompromising conditions. But we've realized that it's not as predictable as we thought it was. We're seeing young, healthy people as sick as some of these older folks. And it's fast and it's unpredictable, and perhaps even more concerning is the fact is that to date we don't have an effective treatment. Once these people get so sick, really all we have to offer them is good ICU care, and we hope that we can provide that care until their disease runs its course and they recover. So it gets bad very fast, and all we have at this point to offer truly is supportive care.
Have the signs and symptoms changed? Have you seen that also develop over time and change over time?
I don't really think we've seen anything changing in terms of how they present with the illness. From the beginning, it's always really been fever, cough, shortness of breath. As the pandemic has evolved, we have learned that many people are relatively asymptomatic. Those are the people who are very important when it comes to spreading the disease in the community. But of those who do present with symptoms, it's pretty much fever and shortness of breath. There is a small percentage of people who present with gastrointestinal symptoms like nausea, vomiting, abdominal pain, and diarrhea. There are rare cases of patients who, as a complication of COVID-19, present with heart problems. Some of them have gone on to develop neurological problems, but those are rare complications of developing the illness. By far, the commonest symptom that we have seen are respiratory symptoms.
It's such an interesting, unfortunately interesting disease, because as you say, some folks are walking around completely
Exactly.
asymptomatic but are positive, and some people are unfortunately extremely sick.
That's the scariest thing. It's a whole spectrum. At one end, you have people who have literally are surprised when they are diagnosed with the disease, and at the other end, these are people who are dying of the disease. And the toughest thing is that there's just no way to predict who will have a bad outcome. You have perfectly healthy people with no medical problem who are on ventilators, and yet there are people who have many medical problems and have very mild and asymptomatic disease.
Meanwhile, we should say that our healthcare system here in Southern Nevada is extremely strong. Our PPE supplies are very good right now. Staffing is very good. Our surge plans are all in place. We're ready for this.
Right. I think a lot of work has been put in by all the hospitals, healthcare systems in Southern Nevada since this pandemic has started. I'm not sure how much the public knows, how much work has been going on behind the scenes to get the healthcare system prepared for this pandemic. I can tell you that day and night since the first case happened, I think it was in the first week of March in Las Vegas, people have been working round the clock on weekends to prepare for this surge in terms of staffing, in terms of PPE, in terms of ventilators, ICU, and bed capacity. And I can say this confidently that I feel that we are prepared. And I think this, while you might be wondering that we just said we crossed our peak, we've plateaued. Why is this important at this point? I think it's actually even more important than what it has been as compared to when we started out with this pandemic, because hopefully as we start talking about reopening our city, reopening our businesses, remember there will be a predictable surge in these cases, and this is expected. We plateaued, and that plateau was not because we found a vaccine. It was not because we found an expected treatment for the disease. We plateaued because we instituted mitigation measures. We stayed at home to slow down the spread of the disease, and that was good because we needed to give time for our healthcare system to be prepared for this. As we start getting back to our lives, there will be an increase in the spread of the disease. But the difference this time round is that our healthcare systems are now prepared to deal with that slight surge in the infection that is predictable. And I think we're prepared for it this time round. But the key here is, although we will ease back into our normal lives, it's important for the public to remember it is not going to be business as normal. We still, as we try to get our business back to normal, our economy back to normal, we still have to try our best to slow the spread of this infection while at the same time trying to get our economy back on its feet. Simple things that we can still try to do. Stay on top of hand hygiene, maintain respiratory etiquette as much as we can. Keeping face coverings on while in public are very simple measures that can be done while we still try to open up our businesses in a sensible, practical, and careful, cautious manner. So while we are slowly going to try to open our businesses, we still will have to keep in mind that we are in the middle of a pandemic. So it's going to happen, but it has to be done sensibly.
We have some questions, and they're going to, I believe, come up right here.
All right.
So that you and I can read them. Here's our first question from Stacy. Do you recommend wearing masks if people are outdoors, in a park, or taking a walk through in their neighborhoods? So what do you think about wearing masks outside?
I always wear a mask when I'm outside right now, right? Because you have to understand the whole purpose of wearing a mask is that if you have the infection and you happen to cough or sneeze, you don't spread it to other people. So while I understand the purpose of this question is that when you're in a park, you're probably at a good distance from every other person, but inadvertently you may pass people in close proximity. So it's always a good idea to keep that mask on.
And we should also say that if you're still touching your
Yeah.
eyes,
Yeah. So there are
the
many
mask is not the
advantages
whole
of the
solution,
mask.
right?
Yes. So the advantages of a mask is, first, it prevents your secretions from getting to others. The other thing is it prevents you from inadvertently touching your own nose and your own mouth. And last but not the least, it keeps that thing foremost in your mind that you're in the middle of a pandemic, and while you're trying to get your life back to normal, you still need to be cognizant of the fact that you're trying to prevent the spread of the infection. I think that in the foreseeable future, this is a habit that we need to develop.
Next question. Okay, how will testing for COVID-19 help ensure community safety, and will people need to be tested frequently to ensure they don't develop the disease between tests? So two really good questions there. The first one, we should say we are obviously ramping up testing in our community. UMC at the forefront and continues to lead the way of testing in the community. The second one has to do with, just because we're negative today doesn't mean we're negative tomorrow, right?
Yeah. So one of the prerequisites, both in President Trump's plan as well as in the governor's plan to gradually reopen the city, is going to be to ramp up our testing capability. The rationale behind that is that the moment somebody becomes symptomatic, that person, no matter how mild his or her symptoms are, should have access to testing, so that if he or she has COVID-19, that person can immediately be identified and his or her contacts can be identified, and all of those people can be quarantined to prevent the spread of the infection. That is the rationale behind having easy access to testing as we open up our city, as we open up our state. Right?
Because how many can one person infect?
Right. So the reproductive number, or R naught, of this disease is anywhere between 2.5 to 3, which means that one person with the infection can easily transmit to 3 people. So you need to immediately identify the person with the symptoms and identify the contacts, quarantine all of these people so that they don't spread the disease. And that can only be possible if there is immediate access to testing. If that person with symptoms can't get to a test for the next 1 week, imagine the number of people this person is going to spread the disease to. So that's the first thing. Now, as to the second question, how frequently do people need to be tested? Anytime they are symptomatic. The whole idea of easy accessibility to testing is that anytime someone has symptoms, once the city and state starts opening, anytime you develop new symptoms, you should have access to testing, because you're absolutely right. Just because I got tested 2 weeks ago, today if I have a fever and shortness of breath, I could have acquired the infection. I should be able to be retested today.
What do you think about testing asymptomatic people? Because as we know, even we can be asymptomatic and still carrying the disease.
That's very challenging, Danita, because the problem with testing asymptomatic folks has to do with the characteristics of the test. And this gets a little tricky here, but let me go a little deeper into this question. There are 2 kinds of testing out there, broadly speaking. One is the PCR test, and the other is a serology, right? The PCR picks up the genetic material of the virus. So it has the ability of picking up active infection. It's picking up if you have virus in your body. The other kind of test that everybody's talking about is the serology. What this one is picking up is if your body has proteins in it or antibodies, which it has produced in response to the virus. Okay, so let me explain the second one a little bit better. At some point in the last couple of months, I was exposed to COVID-19. In response to that, my body, to protect me in the future, developed proteins called antibodies. Those antibodies are now going to remain in my system for a long period of time. I recovered from the illness. Luckily, that illness was so mild that I didn't even know about it. So I was one of those people who had asymptomatic infection. I never got tested by that PCR test. But somewhere down the road, I get serologies done. That was the second kind of test. That serology has the ability to pick up antibodies. That's the test that picks up those proteins that my body produces to fight infection and protect me against COVID-19. That test now turns positive. It tells me that at some time in the past, I have actually been exposed to COVID-19. For people with asymptomatic infection at some time in the past, a serology is probably a more useful test rather than trying to do a PCR on an asymptomatic population. So if I were to take 10 people without any symptom and start doing a PCR on all of them in the hope that, well, you know, there are people who are asymptomatic and they could have COVID. Let me test all of these people with this PCR. I might pick up someone who has COVID. That's going to be difficult. Whereas once serologies become available, you could do those and those would pick up antibodies and tell you that yes, this patient at some point in his or her life actually was exposed and might now be immune. So based on these problems with the PCR test, the recommendation by the CDC and almost every body out there is that as far as the PCR testing is concerned, it should only be done for people who have symptoms of the disease, right? These can be any symptom, and it can be a very mild symptom. Early on in the disease, we were doing it only on people who were very sick and were admitted to the hospital because we simply did not have enough testing capability. Now there is widely available testing capability in this, at least in southern Nevada, and I know that in the upper part of the state, they also have quite an improved testing capability. So now the recommendation is absolutely anyone with symptoms should get tested for COVID-19, and that is the PCR test. As serologies become available in the state of Nevada, there are two important uses of that test. One is to test all healthcare providers because it is a very useful test. These are your frontline workers who are constantly exposed to people who have infection, knowing that they have antibodies that fight the infection is a very useful thing to know because these people hopefully are immune to the disease. Now, let me point out that it is very early in the disease. We do not know enough about this virus to know that presence of these proteins does in fact confer protection, but for most infections, this is a fact. When you have these antibodies, it does confer immunity. But the frontline healthcare providers would all get that serological test. But the other thing is to test your population with that serological test and find out how many are positive, which would give us an idea how many, let's say in the state of Nevada, have actually had COVID-19. So that would be a better test for your asymptomatic population and would give us an idea how much of the population of Las Vegas, state of Nevada, actually has had COVID-19. So going forward, everybody with even the most minor symptom should have a PCR, and moving forward, once serology becomes available, we should do serology testing for our population to find out how much of our state actually had COVID-19, and probably all healthcare providers should get serology tested to see how many of them are immune as well.
Let's take another question. I have a relative who got sick and tested positive for COVID-19 12 days after I last saw them. What, if any, precautions should I take and what symptoms should I look for? I feel fine, but should I tell others I've come in contact with since?
Okay, so this is an example of an exposure to somebody who has confirmed COVID-19. So typically when you are in contact with someone with confirmed infection, you're supposed to self-quarantine for 14 days, okay? So what you would do is you would stay in your home mostly. Preferably you should be in a room with an attached bathroom. You should, if you have to go out, absolutely, it should be for essentials only. When you go out, you should have a face covering on, which most of us should be doing. You should not really be sharing your household utensils with the rest of your family. And most importantly, you should be monitoring for any symptoms during this 14-day period. The symptoms that you are looking out for is a fever. So it's a good idea to check your temperature morning and night. The other symptoms you're looking for is a cough and a sore throat and shortness of breath. These are symptoms, and the period that you're monitoring for is 14 days from the day of contact with that person. And this is typically the time period.
All right, let's take another question, which, by the way, we have about 10 questions left, so we're not going to get to them all, but we'll see how far we can get in the next few minutes here. I'm an essential worker, not in healthcare. Is there a risk if I visit someone who just got out of the hospital for a non-COVID-19 issue?
If the person had a non-COVID-19 issue and does not have symptoms concerning for COVID-19, such as fever, cough, shortness of breath, I'm not concerned about any particular risk.
Still wear a mask, still wash your hands.
Yes. The usual routine: face covering, respiratory etiquette, hand hygiene, and distancing.
Okay. Hit us with another question. How do I differentiate a cough due to allergies from a COVID-19 cough?
This is a tricky one. I honestly don't think the cough is any different. Both of them can cause a non-productive cough. For me, the main difference is fevers. With COVID-19, fever is a very important symptom. With allergies, you're typically not going to experience any fevers. Both of them can have a non-productive cough. With allergies, you seem to have more of a congestion, which is not seen with COVID-19. Shortness of breath seems to be a symptom that we see with COVID-19. With allergies, that is not a predominant symptom unless you have underlying asthma. But the main standing out symptom for COVID-19 is a fever.
Okay, we're going to do one more question here from our community, and that is, how do you get tested for the COVID-19 virus if you have no doctor and no insurance?
You don't need to have insurance or a doctor if you need to get tested for COVID-19. I can tell you, you could pretty much go to as far as UMC is concerned, you could come to any one of our urgent cares and you could get tested for that. There are some other, UNLV has a facility where you can go and get tested for COVID-19. And I think, Danita, after this, we can put up some options for getting tested on our Facebook site.
Absolutely.
But you definitely do not need insurance. You do not need to have a medical provider to go to these facilities. I will tell you, if you do not have serious symptoms like a high-grade fever, you don't have shortness of breath, don't go to an ER to get tested. It's very important to not inundate your local ERs and hospitals for testing. There are other facilities within the city where you can easily get tested. UMC has quick cares where you can go get tested. UNLV has facilities where they will do nasal swabs to get tested. And I will request Anita to put up the addresses and locations for on our Facebook site for you to get your sample collected over there.
And we have telehealth as well through UMC.
And there's telehealth.
Yeah,
okay.
Absolutely. Dr. Asad, what do you have to say to the people who are frustrated with the social distancing and say, come on, let's just get back to work. Let's get back to work today. What's your reaction to that?
I want to do it too. I want, we were talking in the morning early, I miss my routine. I want to be back to my normal life. I want to just get into my day and forget it, put all of this behind me. But it's just not as simple as that. And if you truly want your life to get back to where it was, you're going to have to pass through this. And the only way to do it safely is to go through the steps that everybody is recommending. It's going to have to be sensibly, and it's going to have to be in a stepwise manner. It's not going to be from mitigation measures at 100% today to life back to normal with no social distancing, no face coverings, back to normal today. That is a recipe for disaster. You want to do that, you will end up with mortality, thousands of people will die, we will be back to where we were a couple of weeks ago, and it will serve no purpose. If you want the economy in this city and this state to be where it was, if you want us to be the fun-loving, thriving city that we were, you are going to have to do this for a couple of weeks more. And I think it's a very small price to pay for what you're asking for. This city will open. There's absolutely no doubt about that. The economy will get back to where it was, but there is a price to pay for that. And in my opinion, it's not a big price to pay to get back to the life that we knew, to the way we want our city to be. And it is honestly the only way to get back there.
Otherwise, we'll revert back.
We'll be
worse.
back to where we were.
Yeah. Thank you so much. Your expertise is completely admirable. We so appreciate everything you do at UMC and for our entire community. The governor appreciates you. He has you on his task force. And I sincerely appreciate your professionalism and your calmness through this entire thing. So thank you so much. And thank you for joining us. We appreciate you. We'll see you back here next time on Clark County Television.